Well, hi everyone. My name is Evelien Hendrix, and I'm a postdoc at the Department of Family Medicine at the Maastricht University in the Netherlands. And I want to talk to you about the development of the e-supporter, which is a digital coach for health behavior support for people with COPD, but also with other chronic conditions, and to help them support in self-management of health behaviors such as smoking cessation. Oh. Yes. So there are several challenges in healthcare. One of them is the continuous aging population, and on the other hand, the growing incidence and prevalence of chronic conditions. And also the people who have suffer from multi-morbidity. On the other hand, there is also increasing healthcare costs and shortage of a workforce, and also the shift to more patient empowerment and self-management. So therefore, there is a need for tools that support that self-management. And the objective is to help those patients to maintain a high quality of life despite chronic conditions, their chronic condition, and ensure that they can actively participate in society. And therefore, there is a focus on more guided self-management. However, the problem is that many patients have limited health literacy, so they do not understand the medical information and can use it in the right way to manage their health and their condition. So therefore, our goal is to create a disease self-management tool which it has an holistic view, so it not focus only on smoking cessation, but also on exercising more, a healthy diet, and reducing stress, for example. We want to develop that for several chronic conditions, of people with chronic conditions, and also take into account multi-morbidity. And it's important that patients can use that at home. And there is a link to the usual care, so it's more like a blended care tool. And our idea or our project is about the e-manager of chronic diseases, which aims to guide patients in self-management of their disease and deployment of healthy behavior in daily life. And one part of it is the assessment of burden of chronic conditions tool, and which is already developed, and I will talk about that a bit more later. And the e-supporter, which is the digital coach, the app which patients can use at home to really be coached in self-management. So the assessment of burden of chronic diseases tool consists of 4 parts, and this has already been developed, validated, and evaluated in the past years. It's already developed for COPD, diabetes, heart failure, chronic cardiovascular risk management, osteoarthritis, and post-COVID. And I'll walk you a bit through this. So first, you have a questionnaire of about 20 questions, asking about more a general domain, but also disease-specific and lifestyle. Then there is the visualization, which is like a balloon chart which is easy to interpret for patients and for healthcare providers. And it shows all the different scores on the different domains. Then this can be used as a tool in the consultation between the patient and the healthcare professional. And sorry, this is in Dutch, but the healthcare professional gets some treatment advice, which is based on guidelines and expert input or expert opinion to share with the patient. And then they can discuss or to set goals and define like a treatment or a treatment plan. So they are encouraged to define goals using SMART principles. So not only I want to feel better or exercise more, but really make this more specific, as I showed below. And then the idea is to again complete the questionnaire by the patient at home, and then you can see the differences in scores on the different domains, showing the gray balloons for the previous result. So this is one part of the e-manager, and the other part is the e-supporter, which is a digital coach that the idea is to develop it for all the different diseases which are also included in the EBCC tool. It will focus on different health behaviors, using AI to create personal coaching, personal reminders, and help patients in setting personal goals. And in the background, or the idea is to use behavioral change models and techniques and to guide through this whole process. And we started this year with developing the e-supporter for COPD and physical activity. The development of the e-supporter, we combine like the top three parts, so the development of the content, but also looking at the interface and testing the tool. And we do this as an iterative process. So we continuously involve end users, so patients, but also healthcare professionals and other experts in the different fields of the behaviors and so on. Well, the core team who's working on this is EasyLog, the software company who is developing the technical part of the app, and is integrating the large language models. And we on the other side, from the Maastricht University, we are the other core member. And as I said, the project team is broader, also relevant for the different parts we're developing. And we organize co-creation sessions or feedback meetings to get in touch with them and to think about the content and make decisions and get feedback. So here's an illustration of more about the different parts of the e-supporter. So the idea is that there's one super or a general agent, and below that there are several other agents, for example, the COPD expert or the smoking cessation expert. yeah, we want to know, okay, which variables do we want to measure, and on the other hand, what information do we want to do we want that the users get? So here you have like an overview of the steps of the different parts of the app. I will skip this. Well, it starts with the onboarding, and unfortunately, it's all developed in Dutch, so probably you can't read it, but I will talk you a bit through. So it starts with there's no login or signing up. You can just download it and go on. Oh, I see. I have to wrap it up. But I will go a bit quicker. So here you can see the part of the integration of the ABCC tool in the e-supporter. Yeah, we use like motivational interviewing, also the goal setting with the SMART technique, and also planning of other reminders and notifications to really coach the users through their set goal. They also, the idea is that they get rewards, that there is daily check-in, and that we use information from evidence-based sources. So here's like a list for CPD, but also physical activity. Through this. And last month we had the first feedback round with healthcare professionals. And we used log data and their chat history and also feedback forms to retrieve feedback from them. And they were in general very enthusiastic and positive, but there's still, yeah, of course, there's room to improve, and we also know that. The idea is that we continue this iterative testing and feedback rounds with patients and healthcare professionals, and that later on we do a pilot test of the minimal viable product, and then yeah, in the long term it's the idea to do an impact evaluation study, but first, yeah, we need to take a lot more steps to go there. So yeah, I'll go to the end. Thank you for your attention.
Brilliant.
Are there any questions?
Thank you so much. I'm aware of time where we're on the 4 o'clock mark. So it's been a great webinar packed full of lots of information. We've had lots of interaction in the Q&A as well, and speakers have been answering questions. Yes, I'm sure people will start logging off. I think what we're going to have to do is wrap up the seminar, because it's 4 o'clock now, unless someone does have a question for Evelien that we can just quickly ask. But I think that's all the questions. So Evelien, if you could stop sharing your slides.
Oh, sorry.
I just want to say a big thank you to all of the presenters today. If you want to put your cameras back on, thank you for sharing your insights. It's been really interesting to hear about this cutting edge field, and I'm sure people can drop you an email if they've got any further questions that they want to ask you about all of the interesting work that you're doing. But thanks very much, everyone, and see you next time.
Thank you. Thanks, Mela.
Very much.
Thanks all. Bye.
Bye.
Thanks.
Bye.